to a hot, sticky day in Munich, in a hot, sticky room, but wonderful to see so many people here in the room, and I believe online as well. My name is Dr. Sharon Lewin. I'm the Director of the Peter Doherty Institute of Infection and Immunity, a joint venture with the University of Melbourne and Royal Melbourne Hospital in Melbourne, Australia. And I also have the great privilege of being the President of the International AIDS Society and the International Co-Chair for AIDS 2024. And today we will officially open AIDS 2024, the 25th International AIDS Conference. But before we do, I'm honoured to be joined by an international panel of experts to set the scene and provide a global overview of the HIV response. We will see some incredible breakthroughs at AIDS 2024, including a new case of long-term HIV remission, a report close to my own heart, who's worked on HIV cure for close to 30 years. We may be inching closer. And importantly, an incredible breakthrough of a promising twice-yearly injection to prevent HIV using a drug called lenacapavir. Now, while these advances are truly something to celebrate, science certainly doesn't happen in a vacuum. All around the world, we are seeing an increase in regressive policies, attacks on human rights, the spread of misinformation, cuts to global health funding, and waning trust in international institutions, which are complete roadblocks to progress to ending HIV. And to end HIV is a public health threat, a threat to public health and individual well-being. We need an evidence-based, human rights-based HIV response and a political climate that respects science. The themes of AIDS 2024 calls on the global community to put people first. And putting people first means we must let communities lead. To implement new policies and programs and to advance human rights, people living with and affected by HIV must not just be beneficiaries, but actors driving our efforts. Finally, we can't be complacent. We need to continue to innovate and to advocate for investment in the science that is still urgently needed to deliver an effective vaccine and cure, which is really the only way we will see the end of HIV. Now, we will hear from 5 distinguished speakers who will hear each of their remarks before I open the floor to questions from the media, both here with us in Munich and joining us virtually around the world. Each of our speakers has 3 minutes, and I please ask that you keep to time. I'll alert you when we will need to wrap up and move to the next speaker. It's my great pleasure to introduce our first speaker, Winnie Byanyima, the Executive Director of UNAIDS, and Winnie will share highlights from the Global AIDS update released today by UNAIDS. Winnie, please go ahead.
Thank you. Friends, members of the press, thank you for being here. The report that we launched today, the Global AIDS Update for this year, shows that success or failure in the AIDS response will be determined by the actions of leaders today. We are 6 years away to that target. The leaders' decisions today will decide what will happen by 2030. The data shows progress. 9 years ago, only 47% of people living with HIV were on treatment. Today, that figure is 77%. So 30% increase in getting people treatment in the last 9 years. But the world is not on track to end AIDS by 2030. A person dies from HIV-related illness every minute. It's still a crisis. In 3 regions of the world, new infections are not decreasing, they are rising. Eastern Europe and Central Asia, they are rising. Middle East and North Africa and Latin America, new infections. So we're calling on leaders to take 3 steps. The that can put them on the path to achieve that target of 2030, ending AIDS as a public health threat. One is to resource the response. The HIV response globally is short of $9.5 billion. This gap keeps increasing. And some donors, it's worrying, are saying, well, I think we've done enough. We could do other things. We could leave it here. It's not affordable, and so on. But the same donors in the last 2 years have put at least $500 billion in the war in Ukraine. This is 9.5, less than 0.02 of what they put in one war. So it's affordable, and not paying for it will mean that it will cost more to keep people alive. Half the countries so we want them to maintain the aid. That's a key message. Maintain the aid you've been putting in this response to get to the end. Secondly, half of the countries in sub-Saharan Africa with the highest burden of HIV/AIDS are in debt distress or close to it. We need to have that debt restructured quickly so they can pay for their response. The second thing is to get the long-acting treatments that are coming online for prevention and for treatment available to low and middle-income countries now, not in 5, not in 6 or 10 years' time. We talked about that. Gilead's lenacapavir is a miracle prevention tool, twice yearly injectable. We want to get that to people in Africa, in Asia, in Latin America now, not to be in the United States costing $40,000 or more, when we know that generic production could bring it down to about $100 a year per person. Put that in the medicine patents pool, license it for all the low and middle income countries, and we move fast. Lastly, tackle the discrimination and stigma that is pushing most marginalized people away from life-saving services. That is the third thing. We need to get leaders, political leaders, to stand on the right side of justice, to decriminalize same-sex relations, decriminalize sex work, let people come forward, fight stigma and discrimination, speak up against hate. These are things that don't cost money, but that are about political will. Those 3 things will get us there. Thank you.
Thank you, Winnie. Our next speaker is Chris Collins, President and CEO of Friends of the Global Fight Against AIDS, Tuberculosis and Malaria. Now, I know yesterday was quite an exciting day in the United States, so we're all eager to hear from a US policy expert what this means, particularly for global HIV funding, not to get ahead of ourselves. But we are really grateful for Chris to join us today for a timely assessment of global funding. Thanks very much, Chris.
Good afternoon. This AIDS conference is being held at a moment when the global response to the HIV epidemic is at a crossroads. We have the ability to end the epidemic, save millions more lives, and strengthen health systems as we do it. But will we? Or will we pit health priorities against each other and downgrade our commitments, pleading limited resources? I'm based in the United States, and I can tell you that the commitment there remains strong. For over 20 years, American leaders across political parties have come together, recommitting to the response to AIDS. Now, misinformation held up 5-year reauthorization of PEPFAR this year, but bipartisan commitment to the program and its funding remains solid in the United States for now. Lawmakers know that PEPFAR is saving millions of lives, and if we backtrack on our commitments on AIDS, the immediate result would be disease resurgence. In truth, there's no program more committed to children's lives than PEPFAR. 5.5 million babies with HIV-positive mothers have been born HIV-free with the help of the program. PEPFAR has provided care to 7 million orphans, vulnerable children, and caregivers. This incredible track record is why, during the reauthorization debate this year, we saw people from across political and social spectrums stand up to voice passionate support for PEPFAR. That diverse outpouring of support signals that 5-year reauthorization of PEPFAR can be achieved, and I call on Congress to act swiftly in the new year to do so. Of course, the political challenges to ending AIDS are not just in the United States. Too often today we are seeing policymakers around the world positioning the HIV response as separate from other global health priorities, such as health systems and pandemic preparedness, as if they are not interconnected, as if we have to make a choice. Too often we hear that new funding just can't be found, and we need to rob one health imperative for another. These are false choices. The AIDS movement is fundamentally a movement for health equity. The HIV response is a trailblazer for inclusion and impact and for more responsive health systems. During the worst of COVID-19, people working in HIV rallied to meet the newest pandemic, bringing the human rights values of the HIV response that we actually need in all health programming. The Global Fund, which is having its next replenishment in 2025, exemplifies this opportunity. In the process of saving over 59 million lives, the Global Fund partnership has driven progress on multi-stakeholder decision-making, equity-based programming, and stronger health systems. All donors a step up to make the 8th Global Fund replenishment successful. To do otherwise would be to squander the amazing progress we have made. We need to find the connections in global health programs, not abandon our goals or build new silos. We need to significantly expand investment in health, not just rearrange how we spend current resources. And if we do this, our legacy will be an end to the AIDS epidemic, stronger health systems, and greater health security for all of us.
Thank you, Chris. Our next speaker is my fellow co-chair, Andriy Klepikov. We held AIDS 2024 in Munich in order to shine a spotlight on what's happening in Central Asia and Eastern Europe, and we could think of no better person to give us that perspective throughout the conference, and that's Andriy. Andriy is the regional co-chair for the meeting, and he represents the special focus that we want to place on Europe and Central Asia. Andriy, please go ahead.
Thank you, Sharon. Indeed, Eastern Europe and Central Asia is the region at these days suffer from epidemics the most. Because we have the least number of percentage of people on treatment, only 50%, the lowest as UNAIDS report presented us. This is very worrying signal. And of course, in our region, we have Russian war against Ukraine. But actually, what we observe is a kind of hybrid war Russia has against evidence-based science. We see that ideology, stereotypes prevails over evidence-based intervention. How many people are on opioid substitution therapy in Russia, where 1 million people use drugs? How many? No one. Not a single one. It's prohibited. WHO recommended evidence-based intervention is prohibited. Methadone as life-saving treatment and buprenorphine are prohibited in Russia. How many people have access to clean needles and syringes? We can count nearly by hands. Yeah, I mean, having this huge population. Almost no one. So this is an illustration how important to address it. But what we observe, why I am calling this hybrid war? Because Russia tries to impose these policies on other countries. Look what is happening in Central Asia. Uzbekistan, more recently Kyrgyzstan, more recently in Georgia, where law and foreign intelligence are getting approved, where LGBTQI population are getting brutalized and criminalized. In Russia, they say there are no transgenders. How you can treat people which not exist in front of the doctor or policymakers? So that's why it's very critical that we address human rights. We count on the resources like the Global Fund with effective intervention. We count on resources on PEPFAR for bringing innovation like PrEP, including KBLA. Conference itself presents a great solution. So I'm just showing recently issued GI supplement which specifically focuses on this region, which provides scientific solution what works, and we hope that this conference will bring catalytic effect, cascading down to the countries to improve HIV response. Thank you.
Thank you, Andriy, and thank you for your passion and the work you do. It's extraordinary. Right through the last 2 years, in the midst of war, we saw Andriy every month. Incredible. Thank you. Our next speaker is Ambassador John Nkengasong, the US Global AIDS Coordinator, Senior Bureau Official for the State Department Bureau of Global Health Security and Diplomacy. Ahead of the conference, PEPFAR released a new action plan to address HIV service equity gaps for key populations. Ambassador Nkengasong will share more details on this plan and other PEPFAR priorities. John, please go ahead.
Thank you. Let me, first of all, congratulate you for the conference, the AIDS conference 2024, for the quality already that we are seeing and the ability to bring a diverse key stakeholders to this meeting, which is so central in our ability to turn the tides against HIV/AIDS or bring it to an end as a public health threat. Let me then recognize the distinguished panel. And Chris already gave you highlights of what PEPFAR does, so he made my remarks easier because I would probably yield 2 minutes back to the moderator. But because you already heard a lot about the impact of PEPFAR, let me just pivot to something that is related to what the UNAIDS just released today, the report. Incredible report, the quality of the report, the depth and insights of the report is very clear. Again, it speaks to what the UNAIDS has done over the years, close to 30 years, being a North Star for us and guiding us to where we should go, where the gaps are. So my comments are rather in three folds. One is that we should look at those areas that we've made progress, as highlighted in the UNAIDS report, and try to sustain those gains. Which we have to absolutely. HIV has to be, the response to HIV must learn from other diseases like malaria, the fight against malaria. In 1955, WHO launched a massive malaria eradication program, which was highly successful, brought down the rate of new infections in malaria in countries like India and Sri Lanka to almost at zero. But once the program was stopped, we saw a resurgence, massive resurgence of malaria. So let's remember to sustain the gains in HIV that we've achieved. Second, based on the UNAIDS report, is to accelerate and close the gap. You heard from Winnie that if we do not double our efforts and sustain those gains, we are not going to achieve our goals. We need to accelerate. That requires consistent commitment to funding going forward. And my third point is the sustainability. Sustainability is that we have to today, sitting here, agree that 2030 is only 6 short years from now. And what is our journey to 2030? And how do we look beyond 2030? Because after 2030, as the report indicates, there will still be millions of people living with HIV/AIDS going forward, except we have a vaccine and cure, which we don't have. So that means we have to take advantage of the new tools that we have. In a couple of years, an example of that, we prefer working with others, including UNAIDS Global Fund, to mobilize everyone and work with the companies so that we roll that out quickly. My last comment is really about the important, the key and vital role of the community. We just launched, as you heard, a new action plan which is aimed at strengthening key population gaps in key populations so that we should really be more effective. And that plan has 4 pillars. One is to ensure that funding is maintained within and sustained within country programs, as we do our country program in what we traditionally call the country operational plan, and cap it at about 7%, so that that funding is carried forward year by year and support key population organizations. Second is that if a country does that, we at headquarters are going to match that. Okay, so it's not just a country, it's an incentive fund which says, if you put $1 to that in your country program, we are going to find a way to support that as well from headquarters. thirdly is to say in countries like Uganda, where over the last couple of years we've been challenged with the conversation on the laws that do not favor the LGBTQ population. What do we do there? We've availed $1 million in supporting local organizations to continue to work on HIV/AIDS. And lastly, to strengthen networks of key population organizations in countries that we support, not just in Africa, but in all 55 countries that we support. So that's the core of the action plan that we released. It's a multi-million-dollar program that we are releasing to support that. Again, let me just end my comments by saying that we only win the fight against HIV/AIDS if we strengthen a triangular partnership. Governments leading the response, partners aligning with the vision of the countries, and civil society at the table. We have to upset that table in a way that we all have a seat at the table, but we have a voice at the table. An HIV threat anywhere in the world will continue to be a threat everywhere in the world, regardless of whether you have succeeded in rolling back HIV/AIDS. Once it comes back in any part of the world, it's going to be a threat everywhere in the world. HIV will remain a security threat, a health threat, and a developmental threat.
Thanks very much, John. Our final speaker is Jay Malucha, Executive Director of FEM Alliance Uganda. We often speak in broad terms about harmful policies and their impact. As a Ugandan human rights advocate, Jay has lived on the front lines of Uganda's horrific Anti-Homosexuality Act, which outlaws sexual relations among people of the same sex and imposes the death penalty to so-called serious homosexual acts. Just extraordinary environment. Jay, please go ahead.
Thank you so much, Sharon. Good afternoon. My name is Jay Malucha. I'm a trans man from Uganda, and I'm the Executive Director of FEM Alliance Uganda, which is a community-based organization that provides support services to trans and gender diverse people in Uganda. I'm honored to be here in Munich to provide opening remarks at the 25th International AIDS Conference, and will be the first trans man to do so. In Uganda, being an HIV positive person and being open about being HIV positive is extremely dangerous and life-threatening. My visibility puts my life at risk every day. During my remarks today, I hope to share as much as I can to dispel the many misconceptions about trans men getting HIV. However much we have tried to advocate and let people know that we can get HIV, people still don't believe it. Many trans men are living with HIV despite the myth and misconception that we are not at risk of getting the HIV. After the Anti-Homosexuality Act in Uganda was signed into law last year, the challenges that we already faced as trans people were massively increased. As our lives became even more challenging, transgender people are the most targeted by this law because we are the most visible. We look different, and the act has created a situation where anyone who is easily identified as LGBTIQ, who looks different, is politicized, beaten, attacked, and arrested. Every day, I wake up and wonder if I will be safe. I have to plan every moment of my day. As a trans person, it is not safe for me to be outside and move freely. Can you imagine being afraid to leave your home? To wake up every day and wonder whether it is worth your life to do something as simple as just going to the office and work. Activists in Uganda and around the world have called over and over again the governments to take concrete action to defend our rights and freedoms by fighting for the nullification of this law. I wonder why Europe has refused to act. The German government in particular has done little more than issue statements condemning the law. The lack of action is unacceptable, particularly for the government that is hosting the World AIDS Conference. We need Germany to stop channeling money through government clerics and coughing out, and instead channeling those resources through NGOs that reject homophobia and transphobia and actively provide support to the LGBTQ community in Uganda. Just last weekend, I attended the Global Trans Conference hosted by GATE, that is Global Action for Trans Equality here in Munich. I was joined by 200 trans and gender diverse leaders from around the globe. I heard stories about my colleagues facing violences and discrimination around the world. The truth is, trans and gender diverse people are at a much higher risk of acquiring HIV than the general population. As I mentioned at the start of my statement, this is the first time a trans man has ever to speak at the opening session of the AIDS conference. I'm grateful that our voices are now being heard, and I hope this will not stop with me. I hope this is going to continue, and that we will be given more opportunities to share our stories, our experiences, and our expertise at these big forums. Thank you so much.